Director Gordon, first of all, thank you for really taking up this charge. You've been doing a great job so far, so I appreciate it. And if you could really give us some guidance.
Sure. Thank you, Mr. Chairman, members of the committee, members of the viewing audience, and everybody here. Thank you for this opportunity for us to come and talk with you today about this evolving situation that, as you all know, can be changing by the minute, and it certainly has continued to escalate, and our response is trying to match that. I want to underscore one thing before I start this presentation is the unified front that Commissioner Terry Allen and I have created about responding in this community related to this work. We connect multiple times a day, and without one another, I think it just wouldn't work. So I really want to personally thank him. I want to thank all of the partner agencies, the hospitals who have kind of on a dime made time for us to talk through issues, to help us strategize and plan, and really meet what is becoming just a massive community-wide effort to contain this virus here in this region. And we really are grateful. The folks who are staffing the County EOC and the Joint Information Center have been invaluable in terms of their ability to support the work that we are all doing and providing us information, providing community information, and bringing in the kind of resources we need, which is really, in a moment sometimes, the kind of advice we need and what they're seeing. And we're responding as much as we can. We're seeking guidance from the Ohio Department of Health, who has been a superb partner in this. While there have been trips, and it's not always been the smoothest, we are all relying on each other and figuring out a lot of this stuff as we go, trying to keep up with guidance from the Centers for Disease Control. It has all been incredibly helpful and why I think we have been successful here in our community. You know, this virus knows no jurisdictional boundaries, so we need to be all in, and we truly are. And so I'm just going to start. We have a presentation. Commissioner Allen and I will be sort of tag teaming on some of this and helping with as we move forward. We just wanted to give you some information so you can pass this on as well. There are a number of resources for you at the end of this, which have also been included in many of our communications to you. The fact sheet that was provided should hopefully be widely distributed, and we're updating it as the situation arises. So what is COVID-19? So COVID-19 is a coronavirus. There have been many coronaviruses. There's a large family of them. They are common in animal species. They're rarely in people, but obviously this one has taken a hold in humans. It was first detected in Wuhan City in Hubei province in China in December of 2019, which is why the number 2019 is associated with this particular strain. Believe that all of the tracing to where this really first started is in this large marketplace there in China. As of 2 days ago, it's been detected in 114 nations across the globe. We are in the middle of flu season. We know that the symptoms are essentially identical, so this has complicated matters enormously in terms of all of our efforts, but common symptoms are fever, cough, shortness of breath. The symptoms tend to appear within that incubation period of 2 to 14 days. And as we know, as hopefully you've been reading about this, is that the illnesses range from mild to severe. Some individuals within 14 days they've recovered and gone on about their lives. They've self-quarantined, and some have unfortunately expired as a result. It was originally called novel coronavirus, or as you see, what was the scientific name, but we will be referring to it as COVID-19 or coronavirus. As we see, it has hit the entire globe. From public health, we are utilizing preparedness and epidemiological approach in an all hazards manner, and we do this. This is what we do as public health, regardless of the threat or the infectious or communicable disease. So we are applying this as we are dealing with this particular pathogen. So what we are how we are doing this work is through emergency preparedness and response, epidemiology and disease surveillance, and tracing individuals, and communicating and trying to make sure that all individuals, all organizations, all people can understand this and understand the risk. There has been a lot of public panic, right? There's been a lot of misleading information. There's been a lot of false messaging that's been put out there. And we are now starting to actually experience people walking into places and causing a public panic by saying they have coronavirus, and it is really putting that threat of causing public panic and all of our responses on high alert, and we're all trying to manage through that and create some guidance for us to respond to that. But that is a big issue, and we can talk about that as we go down the presentation. Terry, you want to talk about how it spreads?
Sure.
And before Mr. Allen comes up, just to kind of let you know the order, once Mr. Allen and Ms. Gordon go through this presentation, we're then going to pivot to the healthcare professionals. So just to let you know, you guys are on deck. And once again, this slide, if we could, Director, if we could make it available to council so that we can make sure we deploy it to all of 17 members of council. Mr. Allen.
Thank you. Councilman Griffin. We know that this is a person-to-person spread, which is similar to flu, and so we're really interested in close contacts. That's within 6 feet. So some sustained close contact is what we're looking for when we begin to look and discuss whether or not a person is a person of interest that we're going to continue to track and make a determination, and whether or not through home quarantine, whether or not they exhibit symptoms. So it isn't casual contact. It isn't walking by somebody in a building. It isn't normal transactions passing people by. This is some close contact within 6 feet for some sustained period. So we evaluate that. Public health does that on a range of infectious diseases. This is what we do. We first are busy trying to identify cases. We then work to diagnose. And then we want to think about, once we've diagnosed, we want to isolate those that are sick or quarantine those that are sick. Quarantine is for people that are healthy, that may have been exposed to a sick person, and isolation is for people that are ill. All those methods are tried and true public health methods to prevent spread of infectious diseases. And lastly, we contact trace. So we identify all the close contacts, as we've described, of these individuals that may of somebody who may have been diagnosed or came from an area of particular concern, and we ask them to quarantine during the 14-day period. This is again, standard public health practice. We know that we had an escalation that occurred certainly in early February with what was happening in China and decisions at the U.S. Federal level around travel restrictions and guidance in health departments, like the Cleveland Department of Public Health and the Cuyahoga County Board of Health began monitoring travelers for temperature and symptoms, and we've been doing that since that time. The big distinction here is we initially start this process working on containment procedures. That's the idea of tracking travelers. We know what the source is. On the initial cases here in Cuyahoga County, we knew the source actually of exposure was outside of Ohio, and in some cases it was outside of the United States. And so in those cases, we know that exposure took place, and then we identify close contacts of those 3 individuals. So we've done that. The concern we have now with the recent report from the Canton case is that...
Mic a little closer.
Yes, sir. The concern we have with the report from the Canton case recently that we've all heard about is that we're now moving to this phase of community transmission. So if we have a case where we have someone who was not exposed to a confirmed case, was not exposed to somebody who traveled from an area of concern, then we are not able to begin to contact trace in a clear way in terms of identifying that local source of transmission. So then we move into a range of mitigation strategies that we've certainly heard people discuss around social distancing and a range of other remote work and certainly looking at large events and the like. So we've all certainly experienced those in real time. There's questions about how long this lives.
Yeah.
Something around 2 hours. It could be a little longer. Frequent cleaning is the answer. The transmission issue around people that not having symptoms and transmitting, that's thought to be not a major source and is still not well understood at this time.
So we're grateful for Alex Pelham to put this together. I'm sure you all, as we are getting a lot of calls on how I was exposed, right? This tends to be, sorry, Terry, I'm trying to find this slide. So the whole idea within the realm of possibility, I mean, this is all evolving, but because you might have been in an arena where somebody may have tested positive, how close can you be? And what should you do? Should you be concerned that you might have been exposed? For an individual who has been confirmed positive, and right now we still have 3 confirmed positives in Cuyahoga County, none in the city of Cleveland, and 1 in Stark County. The 3 in Cuyahoga County are self-quarantined at home. They live in a single-family home and have not been going out into the community. Is that correct?
Yes.
Okay. But as we sort of look at the contact tracing and all the work that's being done through public health, is for people to start understanding where they might fall into this realm of, do I need to self-quarantine if I know I've been in close proximity to a confirmed case? And that is something for this type of an algorithm, and what we have been doing in terms of all the interviews that we've been doing with individuals that have come in contact with anybody who is either a person under investigation or a confirmed case. So travel restrictions, as Terry mentioned, right now, the federal government just issued some new ones last evening, and so this is ever evolving, but international travel is slowing to an almost halt. So many things are being canceled. There's a lot of domestic travel that is being curtailed as a result of that, but those are federal decisions. Testing. So we've had a lot of calls and questions regarding testing. Testing right now is being determined based on risk and also availability of tests and clinical prescriptions for individuals who need to be tested. Originally, the qualifications for somebody who should be tested involved and included recent travel to China. That is no longer part of that algorithm, as we have seen community spread. The state of Ohio has some capacity for testing. The hospitals are starting to get some of these tests, and we'll be getting them in short order. And we are working through all the logistics of what that means as test results come forward, and then what public health will have to do in terms of tracking, monitoring, and doing all the investigations for anybody who has been tested positive, who needs to be quarantined, and who are persons under investigation. We are developing some strategy around drive-through testing. It hasn't been stood up yet. We're really thinking through so many logistics of that. That'll be forthcoming, and as information on that comes to life, we'll make sure we have more information. Terry, go ahead, please.
Just briefly, thank you, Merrill. So the idea is that we're not, the testing protocols are tied based on CDC guidelines on who should be tested. We're not recommending that everybody be tested at this time. We're trying to do it judiciously and look at those that are at risk, perhaps healthcare workers and others, EMS, others that we need to monitor closely. So it has to be tiered. You have to sort of work the bugs out of a process. So we want people to know that this is not about mass community testing at this time.
So these numbers were as of yesterday, as it evolves, this might be old news. There are 4 confirmed cases in Ohio, again, 3 in Cuyahoga County, a husband, wife, and another individual, and 1 in Stark County. There are 24 persons under investigation currently in the state of Ohio. There are 21 that are what we call negative persons under investigation, so they have been tested and they were confirmed to be negative. The cumulative number of individuals that fell under the CDC guidelines at the time for testing not testing, but evaluation and investigation were 255 since approximately early February this started. What we know in the United States right now, this is off of the CDC website, the number of persons tested all over the United States so far has been 11,079. 92 confirmed were tested positive due to travel. Community spread, which is against what Terry Allen was talking about a little earlier. We have 75 known as of the 11th. Early on, the CDC, when they were providing this data, they bifurcated the individuals who were on that Diamond Princess cruise ship early on and didn't include those in total numbers. But we have other cruise ships now and concern about that, which federal guidelines have come down in terms of the recommendations on that kind of travel. So for right now, we have 38 plus District of Columbia states with confirmed cases. Again, this might be old as this is evolving on an hour-by-hour basis. Cleveland Department of Public Health, just so you know, this is from this week. These are the number of travelers that the health department has been monitoring. These are individuals who were in China, so we were interacting with them for 14 days while they were in quarantine. They took their temperature twice daily, reported that to us, and we were monitoring that. If there was a spike, then that would have triggered them to need clinical care. So these numbers are starting to go up. The individuals that we need to track and monitor, because it has to be a 14-day period, you know, this is, people are dropping off if they've gotten through the 14-day period with no spike in temperature or no other symptoms, but new ones are coming on, so we're tracking all of that.
Carol,
Yeah.
Thank you. Dr. Collins reminds me that we wanted people to know that they looked at a large data set of about 45,000 individuals in China, and that 80% of the individuals that were confirmed COVID-19 positive had mild symptoms. So that's important to know. So what we're concerned about in particular are folks who have chronic illnesses, heart disease, asthma, folks that may have limited lung function, like chronic obstructive pulmonary disease, folks who may be being treated for cancer and are immune suppressed. They're the ones most at risk. If we watch the news in Seattle, we'll see the nursing home issue specifically, and the governor issued some guidelines around nursing home visitation and monitoring of people in nursing homes to protect these most at-risk individuals. We're not seeing a lot of kids. And so that's currently the data. It continues to evolve as we understand this better.
Yes. So some of the key messaging we wanted to share with you is that, again, we can't underscore how this is an emerging and rapidly evolving situation. Public Health is monitoring it closely and trying to keep up with guidance. You see we're a little distracted by the being inundated with calls, questions, and new guidance. Containment is our priority, and while mitigation is happening as well, it is still all about containing and making sure that the spread does not continue. The County Emergency Operations Center and the Joint Information Center has been activated. The city has also opened their Emergency Operations Center and JIC to manage city hall activities and functions, but working closely with the county, as this is a necessary thing for us to do collectively. Go
I
ahead.
would like to reiterate, if I can, Director Gordon's point earlier that I have had I've been in public health for 30 years and worked for the sort of post 9/11 anthrax attacks, the envelopes, the smallpox vaccination campaign, the H1N1 influenza pandemic, and then, of course, many of us lived through the Ebola response. That in every occasion where we worked in a unified way, city and county, to show that unified response on messaging to the community, it works. It's effective. Meryl and I there's no light between us in the way that we're moving through the process, and I think it sent a strong message. So I wanted to just express my appreciation to the mayor and to council and all the members of the City of Cleveland staff that are working to support that. It works, and it's a very effective response.
Great.
So we also want to make sure you're aware we're at peak season still with influenza. So influenza strains A and B have been pervasive for the last almost 2 months consistently. As of about a week and a half ago, in Cleveland, there were 876 hospitalizations due to influenza-like illnesses, and we've had a fair amount of fatalities as well. I believe there have been 18,000 across the nation related to influenza just this season. So if you haven't heard, you need to wash your hands frequently with soap and water.
My hands are chapped.
20 seconds. I am so impressed with the creativity of people on how to count 20 seconds. So there's a little, like the elbow bumping might be something to rethink, since if you're sneezing in your elbow, you kind of don't want to, share that with your friends and family. But washing hands frequently with soap and water is important, and we here at the City of Cleveland are taking that very seriously. We've included hand washing instructions for people who might not know how to wash their hands, but 20 seconds is a long time, and it's really important to do so. So this is being put up in every facility in the city. And making sure that the general public knows that we are taking this messaging seriously, as well as increasing the amount of sanitation and cleaning that's happening in all the city facilities. And I really give a lot of credit to Director Cox, who's really upped the game in terms of making sure that frequently touched surfaces are being sanitized regularly. You can still get your flu shot. If you did not get your flu shot this season, get it. It's still available, and we highly encourage you to do that. Touching your eyes, nose, and mouth with unwashed hands. Even if you are trying to self-protect by wearing perhaps gloves or a mask, if you are touching something and then touching your face, you still might be transmitting this virus. So the whole reason behind, two reasons behind encouraging the general public to refrain from wearing masks is, one is clinicians, hospitals, et cetera, healthcare needs these personal protective equipment. But two is it might give you a false sense of security if you're wearing this, because there are so many other ways for this pathogen to enter the system through your eyes, your nose, or your mouth, and you might be touching your face in a way that can spread. Go ahead. Were you going to say something? Oh, okay. Staying home if you're sick, staying far away from, at least 6 feet away from people who are experiencing influenza-like illnesses or any of those symptoms. And of course, covering your mouth and nose when coughing or sneezing, throwing away that tissue if you used it, and just being very conscientious of what it means to transmit the cold or the flu or this virus. So there's been a lot of questions about quarantining and isolation. There is a difference. We can go into that if you would like. But we are really, really want to convey to the general public, those who have been essentially ordered to self-quarantine, we really thank you for cooperating. We've faced almost no resistance to this. People understand the severity of this and are really complying with what we have required them to do. So it's very helpful that people are heeding this. We have yet to need to face mandatory quarantining and involving law enforcement on that, but obviously we are thinking through that and have been in other prior preparedness exercises and what it would take, and especially thinking through whether or not we would need in the situation to isolate some of these individuals in a place other than the home where they reside. Personal protective equipment, we sort of talked through this. Last I heard, one of the N95 masks were going for about $48 on eBay. But there's a lot of required elements to this personal protective equipment, including fit testing, et cetera, and we can't underscore enough that these devices are necessary for clinical partners and the false sense of security it's giving to the general public. So please pay attention to that. But we included that here just so you understand when people are using N95 term, what that actually means, and what PPE means as well. We've kind of gone through all of this, but we are doing a lot of information navigating and giving it out and updating it as the guidance comes to schools, colleges, universities, nursing homes, senior centers, all sort of institutions and organizations around town. We're translating documentation, updating it frequently to languages that hopefully are addressing all of the constituencies in our community. We are on many calls a week from CDC to Ohio Department of Health with and Terry and I are talking always. And we're also really looking at all of the plans that we have put together over time because a lot of this stuff has been thought through. We did a pandemic flu tabletop exercise actually in November of 2019, so many of these issues were kind of tested through a tabletop exercise and tweaked, and we're really just deploying what we have been planning and working together through all of that. Yesterday, the mayor declared a proclamation of civil emergency. He issued this yesterday at a press conference at 1:00 p.m. This gives him the authority to call a civil emergency exercise policy group to make recommendations and decisions to determine necessary actions. This is unprecedented times, and decisions are going to need to be made very quickly. We're fielding a lot of requests for how the city is going to respond to things, what's going to close, how to do the necessary, although heartbreaking, decisions of canceling events, especially ones like the parade and the film festival and others that we know that people look forward to. It's really community building, and there's a lot of blood, sweat, and tears put into organizing those events, but out of necessity, we needed to do that.
To support what Director Gordon said is through the Emergency Operations Center, the Joint City-County Emergency Operations Center, the big goal is the combined messaging to lots of sectors. So We're talking with school systems throughout the community. We're talking to, sending information to businesses, faith community, lots of sectors where there are concerns, municipal governments, providing guidance to, working with Dr. Collins and guidance to EMS throughout the community. So this unified message, pushing the latest communication is the way to, we think, control the, the concern and eliminate anxiety because information is power.
So much more on this. This is the mayor's leadership. I'm a part of that as well, and we are setting that up as we speak, and much more information on that forthcoming, along with how we will interact with City Council and what is needed for us to be able to suspend some rules. I don't have much more detail about that, but I just want to make sure you present that to you here today. And I'm almost done here. So I want to also, more than anything, is make sure you know that there are a lot of resources, trusted resources out there that are updated frequently. Coronavirus.ohio.gov is available to anybody and everybody. The Ohio Department of Health is putting a lot of information there, and it's set up well. It's pretty user-friendly, and we really encourage you to use it. CDC.gov is updated as frequently as well. This is from a federal perspective, and that too is set up in a way that you can access maybe areas that you want that might apply only to you. The health department is clevelandhealth.org. We're putting as much as we can on there, but not to replicate all the other efforts. It's things that can be very, very specific for you to download and use. ccbh.net is also, it's a fantastic resource. We're just trying to, again, keep up with it, but these are trusted places to go to answer your questions. And additionally, we want to provide the hotline number that the Ohio Department of Health has put up that we encourage you to call if you have specific questions that and need some guidance is 1-833-4 and then ask ODH. That telephone number is 1-833-427-5634. So these are the resources that are available to you. Anything else, Terry? And then we'll turn it over.
I think the last thing I would say is Merrill and I have been for some time telling folks that this is not a sprint. This is a marathon. We're going to be dealing with this for a while, and we need to get into a rhythm to deal with it in a way that we can manage over time as this evolves, and make sure that, of course, people have information to try to address anxiety. So we need to think about it in that context.
All right, so now what I want to do is make sure that we hear from the medical side. Once again, everyone, this is a briefing, so I want to make sure that everybody understands, and then I do want to make sure that all of these folks do have to go back and get back to their day job to make sure that they are monitoring this effectively. So I know Dr. Simon has another appointment. Do you mind if Dr. Simon goes first, and then we just go into Dr. Collins and the other guests we have? So.
Hi, good morning. I didn't come with a prepared presentation. So,
that's fine.
So
we just want to understand basically what, like you as a large healthcare institution, basically what steps and kind of what advice you might have for our public as well, sir.
Well, I think the message is clear on what to do to protect yourself and to protect others. And I think the important thing, why such simple things are so important in such a serious event, is because this is spread through the droplets that come out from a cough and then land on a surface. So it's not airborne like we think measles, where everybody in the house is going to get it. And so that's why washing your hands. Why? Because you touch this is dirty. You touch your face, it comes in through your eyes, goes down into your nasal tract, and it gets into your system. If you're sick, wearing a mask so you're not coughing on other people when you go out. If you're sick, staying at home. We have the virtual visits, the Express Care Online through Cleveland Clinic. Other systems may have similar ways of not leaving your home if you need to talk to a provider. to figure out whether you need to come in if you're afraid of, if you're a worried well person and think you may have had a second-degree contact, and whether or not you need to be worried or not, just to be reassured, but also if you have cold or respiratory symptoms, the best thing to do is talk to somebody without leaving the comfort of your own home. And that's really what the best first step is. Either call, or if you have some form of a virtual appointment method through your health system, to do that. And that's where we're really pushing Express Care Online. We do have a hotline set up for people who want to ask questions, but again, if they have a provider, we're really going to be directing them to their provider.
Okay, thank you, Dr. Simon. And as Cleveland Clinic being one of the largest institutions, I know that you guys have taken steps to do, other testing and other things like that. So we appreciate you guys with all the work you're doing around that. I'm going to ask Ms. Anderson and Mr. Lane if you have any comments, and then I'll end with Dr. Collins.
I'll fill in.
That's cool. That's cool. I appreciate the opportunity here, and I want to thank the council for having us. The first thing I also want to say, too, is Marilyn and Terry, Dr. Collins here have been doing an absolutely phenomenal job. Sure. And this is an interesting situation, right, in the sense that we are all coming together. We're acting as one. And so I just want to reemphasize again, the more communication, the more types of meetings like this, the more that we're able to message out, the better off we're all going to be. So it's a coordinated community response. Hospitals are working closely with local public health and other community organizations to prepare, as well as be able to actually treat. Local hospitals are ready to respond. I stated that on Mayor Jackson's release on Monday. Their focus is on protecting the health of the patients, the staff, and the community at large. They have developed plans to expand bed capacity for such an event for many years and have been testing their procedures for managing large increases of numbers of patients. It's important to remember that you may not even get sick. About 80% of people who do get sick will only have mild symptoms, and they can stay at home. Only the sickest will be admitted to the hospitals. The hospitals are complying with the testing requirements. All hospitals in Ohio have received and will follow the Ohio Department of Health guidelines along with the CDC for determining who should be tested for the virus. State guidelines state guidelines call for reserving testing for those at highest risk and those who are hospitalized. If you are sick, begin by calling your doctor. Your doctor will follow the CDC and state health department guidance for those who should be tested. If your doctor thinks you should be tested, they'll call the hospital and let them know that you're coming in. If you don't have a family doctor, you can always call your local hospital and urgent care or clinic. Whether it's your doctor, your urgent care, or your hospital, we recommend you begin by calling before you come in. This allows for the staff to always be ready for your visit and minimize the risk of spreading the virus to others. I want to emphasize again, hospitals have enough specialized equipment right now to take care of patients. We're keeping the State Department informed about supplies of specialized equipment like masks, gowns, and gloves. And the Ohio Department of Health is in communication with the CDC about equipment and supplies, and the federal government is working with the manufacturers, as Terry alluded to, and Merrill, to get more of it into the hands of the different healthcare providers. It's important for all of us to do our part. The seasonal flu is still circulating. As Merrill said, thus it's not too late to get the flu shot. Get it. Remember the safe practices as well. Wash your hands, cover your cough, stay at home when you're sick, and don't shake hands. Thank you.
Thank you. I think Mr. Allen had a point on that.
Thank you, Mr. Chairman. I just wanted to thank Brian and Lisa for their support. We've been working with hospital systems for forever across systems. The Center for Health Affairs has been a great partner, a coordinator, and Beth Gatlin, your hospital coordinator, is fantastic for the region, and we couldn't do it without her. I just wanted to say thanks.
Okay, so I'd like to, give a little bit of detail too about our role in the community around hospital preparedness. So, as Terry mentioned, and thank you all, I'll share that with Beth. I think Beth and Gatlin and Andrea Bishop and Tracy Pate are the best in the entire state. We've been doing emergency preparedness for hospitals since 2003. and we've had federal grant funds to help support that. At the Center for Health Affairs, our hospital preparedness program spans 5 counties. It includes 28 acute care hospitals across those counties. Ohio is split into regional coordination for hospitals. That's how it's managed. So there's right now about 5 areas in Ohio that have a regional hospital coordinator. We all work together throughout the state, and we have for many years, along with public health and with public safety, on situations like this, and doing a lot of planning and a lot of, looking at supplies and looking at capacity, bed surge, how many beds are we going to need. Also looking at medications and how we can procure more medications if the situation warrants, or supplies through the federal government. So, unfortunately, we're in that situation now that we're staring down the face of in our local community here and also throughout the nation. One of the things that I want to talk a little bit about too is that we also handle 280 up to 300 healthcare facilities in our footprint, our 5-county footprint, who are under CMS requirements to do emergency preparedness. And we've been working with them for the past 3-4 years and have a dedicated coordinator. So a lot of information has been going out already to those agencies to make sure that they are well aware of what to do in this situation. Brian talked a little bit about, and others, about the exercise that was done recently. We've been doing those exercises. We do have plans around bed surge if we need more hospital beds. How can hospitals convert existing space on their campuses into additional beds? We look at things like who could go home, possibly elective surgeries. Can they be canceled if we need more bed capacity? We also know that through the Ebola situation we faced a few years ago, Metro Health has a very specialized program to handle patients with infectious diseases, and they have specially trained staff to do that. And if you would like to look at more information about that capacity, it's on Metro Health's website. They do an excellent job of displaying that to the community. We've talked about PPE, concerns about personal protective equipment. So what have hospitals been doing? Well, they're on an allocation system. All of the manufacturers in the country, the ones that still have anything, and of course we know most of everything in China, even through distributors here in this country, they were shut down. They're on an allocation system. We're watching that. We're reporting that to Ohio Department of Health on a regular basis. And so in the meantime, what is happening in hospitals is conservation of PPE. So patients may get a mask, and everybody else around them may not use masks because they're holding that. They have that N95 mask. If the situation warrants, they're going to put on a respirator. They may cohort patients. So we're doing the best we can to conserve that valuable equipment. We've talked about, ventilators. That's been an issue. Do you have enough ventilators? That ebbs and flows every day. Patients go on ventilators. Patients come off ventilators. At times, hospitals rent ventilators. Not everybody needs a ventilator. And again, it's the sickest of the sick, and that's really up to, the clinical judgment of, my fellow colleagues and others here to make that determination. Who needs that kind of care? Who needs to be hospitalized? We are, as of this week, we have started phone calls with the Ohio Hospital Association under the Governor's Advisory Group. And so information is going out throughout the state around things that are changing. Yesterday, guidelines went out for outpatient providers on how to manage coronavirus. We've talked about staffing plans in hospitals. We're in the midst of a nursing shortage nationwide. Yeah. Do we have enough staff? Hospitals have put in place staffing plans to look at how they can add to their staffing, how can they look at expanding their as-needed staff, agency staff, and how to, so they were all told yesterday, and we've passed that on, to take a look at your staffing plans. So I think in the midst of this, and I very value Dr. Simon's recommendation, telehealth. The feds have relaxed some of the regulations for Medicare and Medicaid around telehealth visits, and permitting that, and also telling people to stock up on their medications if you need to, and relaxing some of those rules. Those are all really important considerations as we move into this situation.
Thank you so much, Ms. Lane. I appreciate it. And I want to end with Dr. Collins. And once again, for my colleagues, once Dr. Collins makes his statement, then we're going to transition to health. I know that there are a couple of folks that have questions. We're going to ask if Dr. Collins, Mr. Allen, and Ms. Gordon can stick around. And then we're going to go into the safety side, and then we'll make sure that we have questions. I encourage you to write your questions down. We have a lot of content we have to get through, but I'd like to thank you. And thank you for coming, Dr. Simon.
Thank you, Dr.
Mr. Collins.
Thank you, Mr. Chairman. While today primarily I'm here in the capacity to support and speak with my public safety colleagues, I think there are a few comments that need to be addressed that are worthwhile in just the general health care. First of all, you've heard echoed multiple times today that we have multiple obligations. We have obligations to the individual patients we're caring for, we have obligations to the community of a whole, and we have obligations to the personnel that are taking care of all those patients. So we are trying to meet all these important obligations. While there's a lot of uncertainties as far as how this will evolve and unfold in our community, one thing I'm confident of is the talent that we have supporting our community. And this is not the first time we've walked down a crisis aisle together. As you've heard from Ms. Anderson and Mr. Allen, the times that we've come together in crisis go back to the early 2000s when we were doing planning for nerve agent attacks and then smallpox. And one thing that wasn't mentioned that is really helping us right now is we successfully came together as a hospital community, a public health community, and a public safety community to support the RNC. And we're actually taking advantage of those relationships and those communication lines that were already made to bring everybody back together and have these important, quick conversations of the steps we need to take to be as prepared as we can. The comment that comes to mind, and I've said this to a number of our staff, is, and there's a quote, and you know that I like quotes, Mr. Chairman, and I apologize that I can't attribute this quote to an individual or a book, but I know it's out there somewhere. It's, "Into the valley of uncertainty rides the legions of doom." And right now, there's a lot of anxiety and angst about all of this. We are 5 months as a world into this crisis, and we're learning more and more every week. And I think it's important that all of us, as we're thinking about how we're going to respond, respect to the fact that a lot of our knowledge is very new. We're still waiting for some of the data to be useful, worthwhile data, so we can draw good conclusions. As recently as 36 hours ago, the CDC modified their PPE recommendations, recognizing that the transmission of this is most likely droplet in almost all cases. So simple surgical masks can provide protection for most healthcare providers. So that was a huge step, and that will modify how we take care of patients. So when we look at this as a community, we look at the preparation phase, and we've been preparing for this in multiple ways over the years. We've transitioned from preparation to management of sporadic cases. Soon we'll transition to management of community-wide disease with our normal resources, and depending on what direction things head, we may have to transition to management of community-wide disease with limited resources. Then the important recovery phase after that. But the thing if I can stress one thing to all of you, I think that the greatest strength we have going into this is the relationships that we have between our two public health agencies, with our hospital association, and our public safety providers. You have a very strong foundation there, and I know there are going to be challenges. I know there are going to be things that when we look back at this, we wish we'd done differently, but I will tell you, you have a very good talent team that's helping with this.
Thank you so much, Dr. Collins. And Dr. Collins, you said something that I think speaks volumes, and that's that relationships are critical. When you have relationships, cross-sector relationships, you're able to get things done. And that's what I'm hearing everybody saying, is that we basically have experience working with each other. Even though there are a lot of unknowns on this, we still do have a team that has been working together and are willing to handle this challenge. What I'm going to do is I'm going to ask if Mr. Allen, Dr. Collins, and Director Gordon can stick around, but everybody can be excused. If they can sit in the audience, I may need to bring you back up to the table, but we're going to transition into the safety side. And I would love Ms. Anderson and Mr. Lane if you guys could stick around as well, because there may be people that want to have questions for you off, as a sidebar. But I want to move to the safety presence. And once again, to my colleagues, please write your questions down. I am taking people with questions. I do have Kelly and Polincic that had a couple of conversations, but it's going to be after we hear from the safety side, okay?
Thank you,
All right,
Chairman Griffin. Director Gordon, I want you to stick around, actually, to stay at the table, if you would. And Dr. Collins, if you wouldn't mind. Thank you, and please stick around. I'd ask if we could have Mr. Szabo and Mr. Pelham join us at the table, along with our medical director, Dr. Collins, and health director, Gordon. And I want also the spokesperson. I know we have Chief Williams. Chief, is that going to be you for police? This portion is going to focus on protocol from police, fire, and EMS when we are responding. So I want the spokesperson for fire, the spokesperson for EMS, and the spokesperson for police, if you would join us at the table.
Mr. Chairman?
Yes, Director.
While this transition is happening, I just wanted to perhaps use this opportunity to say one thing.
Yes, please.
We've had a lot of calls from people who are asking how they can be helpful, right? Maybe just like there's so much going on, how can we be helpful? There are a lot of people, because so many things have been canceled and things are closing, how to access food, how to access some basic needs is of utmost concern of ours as well. Kristen and I from the Greater Cleveland Food Bank talked yesterday. They are in need of volunteers, as volunteers are concerned about how this distribution is going to continue to happen. So we encourage people to, that's one option, just to let folks know. But if you want to help, that's one avenue, and calling their hotline to volunteer would be incredibly helpful. That telephone number is 216-738-2067. They, too, like everybody else, are trying to determine a continuity of operation plan, and instead of having maybe a mass where people come to pick up food, it might be drive-through, it might be a number of other ways. They're working with the state to ease up all of those qualification measures that need to take place in order for people to get the food. But they need folks, they need bodies to help. So for anybody in the viewing audience who has inquired about ways that maybe they can be helpful, and we'll continue to see as these arise how we can put that kind of information out. But I can't underscore that enough. And I will turn to my most respected colleague to my right. The public panic that has happened now a few occasions that I've heard of, where somebody walks in and says that they have coronavirus, is causing an enormous alarm. Yeah. We know of 3 confirmed cases in Cuyahoga County and 1 in Stark County, and those people are quarantined at home. They are not walking around, they are not going to the grocery, they are not presenting themselves. So while we know that numbers will go up as testing increases, the public panic, and hopefully you can speak to what that is, as that has severe charges and severe consequences if you cause a public panic. But we had an incident in City Hall yesterday that it just upended everything. So we really want to encourage the viewing audience, and something else for you all to consider. And we had one case came to me early today of how to handle this, because it's calming staff down, needing to be rational, kind of thinking through how we are responding. So I hope that as you transition to public safety, that can be one thing that's added to your agenda.
One more question, Mr. Chairman. If we could have Mr. Allen also join.
Yeah, he just stepped out of the room, yeah.
So if you could have
So,
him come in.
thank you. There's one chair at a time, but I appreciate all the contribution. This first session was really informative. Dr. Collins, I want you here too, because as our medical director, as we hear what each individual department is doing, it would be great to have you give perspective. I don't know if I think I want to lead initially with our emergency operations centers. How are we doing? And then I want to hear from Mr. Pelham, to kind of hear what the county is doing, and then we'll start with Chief William, we'll go Chief Cavillo, and then we'll go to Deputy Chief Miller about kind of just protocols within the three departments. So, Mr. Szabo.
Thank you, Mr. Chairman, members of the committee. Thank you for the opportunity to speak today. I'll be brief about the operations of the Emergency Operations Center. The City Emergency Operations Center has many responsibilities. Primarily, we do operate the Emergency Operations Center, which is, for lack of a better term, a command post for operations. We activate for either planned or unplanned events. Obviously, this is an unplanned event. I think all of you will remember during the RNC, we activated most recently Major League Baseball All-Star Game and July 4th fireworks, things of that nature. So there's many activations that take place with the city. I'd also like to reiterate the same information you've heard. We have a great working relationship with the county. The county has their own emergency operations office, as do we. We've been hand in glove with them throughout this event. We send representatives to them, and Alex Pelham was my predecessor, and his fingerprints are all over the Cleveland office. He's done a great job setting it up, and we do appreciate that. Basically, we also do training at the EOC, train city employees, external partners. Last year we had an issue with cyber terrorism, as you all know, and we had a tabletop exercise including IT, the FBI, a number of our partners, and it was very instructive, very helpful. At this point, we have activated the city's Emergency Operations Center effective this morning. We're going to operate from 9 in the morning until 5 in the evening on weekdays right now. If circumstances dictate, we'll change that right now. But we're basically operating. We have the Executive Policy Group is represented there, Health, and we also stood up the Joint Information Center for the city, and the county has one as well. And basically what we're doing is managing the event for city-specific issues. The county's doing a great job doing the county perspective and statewide, and the county issues situation reports twice daily. I receive those reports and I push those out to cabinet members and a number of our partners, so that will continue. The city operation are going to be publishing 2 situation reports that are city specific, and those will go out at 1 o'clock and at 5 o'clock each day, and that'll just basically take any information from all the directors in the city and our partners, and any information city specific would be on those reports, and we'll push those out to that audience as well. So we'll work very closely with the county, maintain operations in the event that we need to activate on longer periods of time, then we will do so. And the Joint Information Center is also pushing out a great deal of information in coordination with the health departments to make sure that anyone who needs information will receive it. And I understand that the 311 line is also a part of that activation, so the public can contact us in a variety of ways to get additional information.
Thank you, Mr. Szabo. Mr. Pellin, let us know kind of what the county's doing in terms of coordinating with multiple departments and agencies.
First, thank you for being here. And as was echoed earlier, the coordination and the partnership with Director Gordon and her team, with Terry's team, with the county, which really started in January on this. So it hasn't just started since the county opened the EOC once the announcements were made. These multiple daily emails and conversations started in January, where we were sharing information and starting to build these plans and build these relationships. The county's EOC activated roughly 2-3 hours after the announcement was made here at City Hall. What we have there is we've got a conglomerate of partners, which led by both the city and the county public health. We're able to support them through public information pieces where we can target specific audiences. We can target different stakeholders, to where if you're a mayor on the west side and you're a mayor on the east side, or you're the mayor of Cleveland, you're getting consistent message from one place, from the professionals that are pushing it out. We're able to meet with the Cuyahoga County Fire Chiefs Association, so we're able to represent all the fire chiefs and push the same protocols, push the same safety guidance from the CDC and other measures to the our chiefs and our stakeholders to ensure preparedness for both them as well as our residents. You know, these viruses don't respect borders or jurisdictional boundaries, which is why, you know, I love, and it's in the true essence of emergency management and public health, that we're working together, and we continue to work together and to continue to be on the same page. We have partners from the Red Cross working on contingency plans about if someone is quarantined, about how we can get them supplies and how we can get them, we can help take care of them if they're unable to do what they need to do. And many other facets of that. We are looking to be open 7 days a week at this point, from 7 to 7. The weekend hours may vary a little bit as we go into the first weekend, we're going to see. But right now, we're 7 a.m., 7 p.m., and cranking stuff out, coordinating.
Thank you, Mr. Pelham. So I want to hear now from the different divisions. Chief, talk a little bit about what our officers are doing when they respond, and then the item that Director Gordon mentioned, if you could touch upon that. And then also, I'm aware that there was a kind of a hate crime situation that happened in New York City with a person who had Asian ethnicity. And so just speak around all those broad topics and kind of what our protocols with interacting with individuals around this matter.
Sure, Mr. Chairman, committee, thanks for having us today. As far as the Division of Police, we were on this issue about a month and a half ago and pushing out orders throughout the division for our employees as far as personal protective equipment, what this whole thing means that we knew at the time. It wasn't a point of our officers to actually don protective equipment on every call and things like that, but just awareness on making sure that if people present with certain symptoms, first and foremost, we're to get medical attention for that person. And then our EMS workers and our folks from fire actually have the best personal protective equipment to deal with those folks, but just to make sure our folks are aware of what's happening out there and how we deal with it on a day-to-day basis. We always come in, well, not always, but safety personnel come into contact with people with varying levels of, any kind of illnesses on a routine basis. And we didn't want to panic our officers, and definitely did not want to panic the public by officers sometimes appearing in personal protective equipment. So our stance has always been to make sure that we have the correct information, that our officers are cautious, and that if we see things that fit the criteria, that we make the proper notifications to our medical personnel so that they can respond and handle that person appropriately. All of our frontline officers are equipped with both protective masks, gloves. We're in the process of ordering face shields as well as protective gowns. When it gets to a situation where the health director orders a quarantine or isolation of a person and that person does not cooperate, if there's a known case of COVID-19, then she has the power to order that person basically quarantined. And we can, as law enforcement within the city, enforce that. So we have developed specialized teams of officers to be able to do that with a higher level of personal protective equipment to deal with those folks. But in concert with both the health department, social service agencies, of course our medical professionals, to make sure that we're giving that person the proper information, making sure that they understand what the law is in regards to that isolation or that quarantine, and then also making sure that they know that they have the support to get through that time period in their lives and not to be so-called isolated, not being able to take care of their basic needs and the needs of their family. So in the city, with Director Gordon's leadership, we have worked on developing that layered approach to make sure that folks that are in certain situations know that they are going to be properly cared for, that they're not going to be just isolated on their own. Again, the Division of Police has divisional notices out that explain to our officers what this is all about. We actually convened a command staff meeting this morning with all of our divisional commanders and their staff to make sure that we get the proper word out on the newer developments as it relates to canceling large-scale events and things like that, namely St. Patrick's Day, the film festival, and probably some of the other events that are going to come up, and what our posture is going to be. Although those events are canceled, Division of Police and Department of Public Safety as a whole still has to maintain a presence and be available to assist people that may or may not come out or may not be in and around these events as the weeks go ahead here.
Anything else you wanted to add with respect to the item that Director Gordon brought up?
Yes, Mr. Chairman and the committee. The director talks about inducing panic, and it is a crime in this city to falsely induce a certain type of panic. People basically saying, hey, I have the coronavirus without actually having it or having symptoms, things like that. It is a crime. It is an arrestable offense, and it's something that we should be cognizant of. It's something that our community members should know is going to waste a lot of valuable resources, and on top of it, get them a criminal charge if they are found not to have that. And we had a little scare in City Hall yesterday, and the person was not found to have, at this particular time, be infected with the coronavirus. So people need to be careful. We talked about this a lot during a lot of the hoaxes that happen at schools with active shooter and things like that. People call in threats. It's a crime. And at this particular point in time, in our country and the world, we should be coming together to make sure we can do everything we can to get through this and not to unnecessarily panic folks.
That's fine.
Thank you, Chief. Again, I appreciate so the protocol, is it happening with at roll call? Are you educating? Could you speak a little bit about that? How are you disseminating the information, making sure that all of our frontline officers are prepared to engage with the community in the rare instance something happens?
Yeah, Mr. Chair and the committee, again, we put out a divisional notice about a month and a half ago that spoke to what we're going to do with responses to cases of this sort or potential cases. Our officers know that. It's disseminated at roll call. It's talked about basically on a daily basis. We're now in the process of putting together and ensuring that we have continuity of operations plans for our division as well as the entire city. So that if an officer gets sick, what happens? If our staffing starts to shrink due to if schools close and folks have to find childcare and things like that and can't come to work. What do we do with that? How do we actually maintain services here in the city? So the Division of Police, as well as all the other divisions and departments in the city, are working on those plans of how we maintain operations within the city. Also working on how, if a person is infected, how do we stop that spread throughout a department, a bureau, an operation? Having folks work from home so as not to put them in a situation where they can be affected because of the contact with multiple folks within that division, that bureau, that district, or multiple contacts with the public. So the city as a whole, through the mayor's office, is working on those plans. Division of Police is definitely working on those plans, along with making sure that if there are personnel shortages, that we have assistance from our partners, the State Patrol and others, all the way up to and including the National Guards if it gets to that level, which I hope it doesn't get to that level.
No, very good. And we saw what happened in New York yesterday with the National Guard being coming and cordoning off a certain part of the city where there was several incidences. So we appreciate the attentiveness to these matters. Chief Cavillo, talk about fire. Not only are you're men and women fighting fires, but they're often on emergency medical runs. So talk about what protocols are being implemented for fire.
Yes, sir. So the Division of Fire has 36 first responders. That's the engine companies, ladder companies, and rescue squads. 5 of those companies are paramedic pumpers. So we provide emergency medical technician, responder, first responder, and also paramedic first responder. So we're very sensitive to that issue. We actually follow the protocol, the medical protocol under Dr. Collins, myself, and my colleague from EMS in regards to PPE, scene size up, looking at the patient to see what we're dealing with, severe respiratory, taking that body substance isolation. And we do have all that equipment now in case the need is there for this particular virus. My division has tested all our members with the N95 mask, and we have that PPE available on those apparatuses. In addition to that, we work in conjunction with the EOC, and we've been working with Alex and Director Sabo for many, many years. And I just want to echo again with Dr. Collins, because the RNC has brought these professionals easy access, and we're familiar with each other in whatever venue we have to deal with viruses, any huge gatherings, and it's really a welcome to actually have all that information. On a daily basis, like the director stated, I'm getting the situational reports from local and federal CDC so that we can actually put that out to my division through SharePoint. My Chief of Operations, Chief Burchek, he's getting that information to make sure that we filter that down to the division, along with Chief Jim Stoom, who is actually looking at the health and safety aspect of what we're doing in the Cleveland Division of Fire. And if this does ramp up, we'll be ready as far as getting that information from the Civil Emergency Committee and also our partners in the EOC with the city and county. I also want to add, Lieutenant Mike Norman is our public information officer, and he's working in the Joint Information Center along with his other colleagues from police and EMS to make sure that we have that constant current information.
No, I appreciate it. I've noticed your Twitter handle, you're pushing out good information and content around this. The more that we can, and I think Director Gordon said it in her opening statements, this is an evolving issue, but sending out timely, real-time, factual information, fact, not fear, is really important. So appreciate your work.
And one more thought. Once again, my leader, Director Michael McGrath, he oversees police, fire, and EMS, so he's my lead. We communicate often as far as, what we need to do, what we need to provide, and we're here to serve and protect the people.
Great. Commissioner Miller, talk a little bit about protocols that's happening with the EMS, and I would suspect, I know there was a situation that happened the other day, so give us your perspective.
Okay. As of, when this virus started making its appearance, we've had daily conference calls with Department of Health. Other fire chiefs the county fire chiefs had a conference call yesterday. So we're just trying to gather as much information. So our protocols may change as we learn more about this virus. So right now we have protocols in place. It starts with our call screening. Somebody calls 911, and if they ask or answer some of the questions, and then the alarms start going off saying this may be a potential patient. So when, if it is determined that this patient is potentially has the virus, then myself or Commissioner Carlton will get a phone call, and we'll get in contact with the Department of Health to get their opinion on how we should respond to this call. If we do get the alert saying this patient is potentially contaminated or potentially potential patient for the coronavirus, then we'll have a unit respond. They'll gown up in their infectious control gear. We have PAPR masks, the hoods, and we'll also send another unit to EMS headquarters where we have a truck ready to go, an ambulance ready to go, and respond there and transport that patient. The reason why we do that is so we're not putting our frontline ambulance out of service for decontamination, which will take possibly 6 to 8 hours to decontaminate the whole truck. So, as you mentioned, we did have a call yesterday where we had to put this plan in motion. If I can call Commander Chapin up, he was on scene. He'll be able to give you more information.
Commander Chapin, would you be very brief? Come on up. Just briefly, and I don't know if you need to get too granular, but I mean, I think Commissioner Miller, you gave a good overview, but you did respond to a call yesterday. If you could just be brief on how you handle that matter.
Yes, yesterday we received a call for a patient who had traveled, had a fever, and had a dry cough. So we did enact our protocol for this situation. I actually responded to the scene myself to make sure that everything went okay, and it did. It went very well. The crew responded to the scene. They donned their PPE prior to entering the scene. Excuse me. And when they entered the scene, another unit showed up with the unit that Deputy Commissioner Miller had spoke about that has the front that is sealed off. The other crew then drove both the units. The crew that initially responded came down with the patient with their PPE. They had a mask on the patient as well. Once we investigated a little more, it turned out that the patient did not actually have a fever. So he didn't technically fall into the requirements, but we continued with our PPE just the same. And then we transported the patient to the hospital. He was in stable condition. We had notified them prior to arrival. They were ready to meet us. They took him into their special isolation room. And then we brought the crew out that responded. We deconned them. They doffed their PAPRs, which is the air purifying devices. And then we took the vehicle over to our, we call it our decon chamber, where we used vaporized hydrogen peroxide to sterilize the entire truck.
Very good. Dr. Collins, you're our medical director. Anything you want to add to kind of just hearing fire and EMS's protocol?
We've been watching the situation very closely, and we've been connected to our colleagues in Seattle and other major cities in the world, learning from their experiences. The call that occurred yesterday went smoothly. It is an example of what occurs many times in our job, is that we don't really have the full picture right away. And we need to have that concern until there's no longer a reason to be concerned. And so I appreciate the efforts of the Deputy Commissioner and the Commander and the crews that took care of that patient yesterday.
Great. Well, let me do another public service announcement. Again, as Director Gordon said, the food bank really could use some volunteers. So those who are listening, if you want to volunteer and contribute and help our community, contact the food bank at 216-738-2067. 216-738-2067. Maybe Channel 20 could put that phone on a ticker at the bottom of the page. Director Gordon, any final remarks based upon what you just heard?
We're all very busy at work at this.
Yeah.
So if that has not been conveyed in any way, shape, or form, we all are. We're also learning a lot from ourselves, from others. Ohio was one of the last states to actually get a confirmed case, so we really watch what other states and other communities were doing. That is sort of the network of all of what we do professionally and why this is so critical. We really appreciate this opportunity to kind of speak to you and speak to the general public. It is unprecedented times, and it's an evolving situation, and it is very scary. We don't underscore that or minimize that at all. So it's very important for people to go to trusted resources to learn as much as they possibly can, and do what they can do to minimize this, their potential exposure and the spread of it. Really, that prevention message is being said from everyone, and we really ask the general public to take heed. If you are experiencing influenza-like illness, this is not a confirmation that you have it. You need to call your doctor and take the prescribed routes that have been outlined here today and have been said many, many times over the media. And we really want to also extend an appreciation to the local media here and to continue to put out as much information as possible, again, from trusted sources of the right course of action to take. But going from causing a panic to trying to mitigate the panic. We're all trying to work on that, and you fielding these calls as well, we really appreciate that. So as much as you can, kind of extend what is the information as we know it, and decisions will be made very quickly should they need to be as things are escalated. That's why working together is so critical, and I'm just so grateful that we've spent enough time practicing and going through trainings and working through preparedness and sort of getting to know one another, so that these partnerships were sort of shovel-ready or key-ready or whatever that term is, so that we really could put on this enormous deployment strategy.
Great, thank you, Director. We will be working to our colleagues, our communications department, to make sure that we have all the right information. We'll send it out to everyone so you can share with your EAs if a call comes. Again, the best thing we can do is create calmness and clarity. As the Director and Director Allen said in their statements, this is evolving by the hour. And so it's hard to give out real-time information as to what's happening, but we will share that with you. Director Gordon, you had another thought?
Sorry, I wanted to just say one other thing. Next Tuesday is not only St. Patrick's Day, but it's also Election Day. We've been working very, very closely with the Board of Election here on all the precautions they need to take in each one of the polling locations, sanitizing procedures, et cetera. One of the things that the general public should know if they go to vote in person is you can bring your own ballpoint pen and use that to color in the bubble. It needs to be a ballpoint pen. It can be blue or black. There are two items that one communal items that one touches. There is a stylus when you sign in, so those will be sanitized frequently, and the pen. So if you bring your own, it's advisable. Felt tip is not allowed, but ballpoint pen. But we really have been working very closely with them to minimize any chances of exposure, and working with the poll workers. As you can imagine that too, just from fear and panic, people are rescinding their offer to work that day, so they too will need individuals. So you can check the Board of Elections website, but a lot of, for all of these kinds of things,
Sure.
We're working to provide guidance to all of these types of organizations and efforts, because that's critical for our community as well.
Very useful information. So what we're going to do, I have a couple clarifying questions, then I'm going to go to Chairman Griffin, then Council President Kelly. I have Councilwoman Cleveland, Polensek, McCormick, Conwell, and Slife. Questions should be clarifying questions. We're going to limit questions to about 5 minutes. These fine people have to get to work. They're busy people, and this stuff is changing. So directors and those who came, we appreciate. My one question that I have is, I have received 2 calls yesterday evening about, now that the St. Patrick's Day parade is canceled, what about the congregations? That's going to happen in these social settings in pubs and bars and whatnot. And has there been a protocol established? So I'm going to turn, I guess, to, I don't know if it's Commissioner or Director Allen. Do I go to you? Could you give us perspective on that?
Thank you, Mr. Chairman.
Individual businesses who have large congregating areas.
Right, so there have, thank you, Mr. Chairman. So there's been sort of a flurry of guidance that's been released from the state level and from the federal level. And so that we understand that there's some pending additional granular guidance on mass gatherings that should be headed our way. I think as of last night, we understand we're expecting some additional details for mass gatherings from the state, and so we're waiting for that.
That's good to know. All right, and then the other, just last question I have is, Director, you talked about cancellations. And again, this is evolving, and there's no established protocol right now. We get that, but looking into the future, the next 30 days, I'm sure we're looking at permitted events. Again, speak briefly, how will that be handled?
So this is why the mayor put this committee together, that he has the authority to do so. Civil Emergency Executive Policy Group. All of these kinds of items are, we've been thinking through, actually the Health Department has been thinking through for all these special events where people need a food operator permit, what happens if something is canceled. So these are operational things that we're all trying to work through and understand how we will, from a business perspective, if there's going to be a refund, how that's going to be processed, et cetera. So please stay tuned. All of these things are being thought through. Same with sick leave policies, same with work from home, same with a whole bunch of other human resources matters within the City of Cleveland administration, as you know, as are others trying to figure out how to manage through all of that. So these are there are a lot of people thinking about that now and making some of these recommendations up to the mayor.
Very good. Chairman Griffin.
Thank you so much, Mr. Chair. And I would ask if we could just, I know that I have 3 quick questions, and if we could just have as much brevity as possible so that we can get through 3 of them. One is if you don't have insurance, because we have a lot of people who are uninsured, where would they go in order to get a test if a person does not have insurance?
Mr. Chairman, the hospitals are, would you be able to answer that?
Certainly. I mean, there are...
If you could.
Please, people are watching this on the World Wide Web.
And do hospitals turn them away, or how?
No. No, there are actually laws in this country that require hospital emergency departments to evaluate, treat, and determine the course of health care that is needed for any individual coming into their facility. So nobody will be turned away that comes to an emergency room regardless of reason.
Okay, thank you so much. Appreciate that, Ms. Anderson.
Dr. Collins, please.
May I modify that, if you don't mind, Lisa? We certainly also want to look to create a pathway that if people need testing, they don't have to go to emergency department just to get a test. So I think there'll be information on that coming up at some point. But we certainly don't want people that may not be infected going to places that they may be exposed to infection.
Right. Okay. All right. The second question that I have is regarding public-facing or public places. We have a lot of places like grocery stores, barber shops, other kind of social gathering. So they come in close personal contact with a lot of the constituencies that they serve. How do we manage or look at those kind of things?
So, Mr. Chairman, and I'll have Terry respond to this as well, an enormous amount of time is being spent on providing guidance to any and all constituencies. The ramping up of sanitation procedures and donning some protective equipment, changing gloves often if you're actually in physical, if you're touching your client perhaps. I think that there's, and that's why we say there's guidance on all of these websites, the state and the feds for hair salons, et cetera. A lot of our economy is based on services where people come in very close contact with one another. The social distancing is what we've been continued to promote, but if that is not possible based on the service, really helping people think through how to manage through that. Terry, do you have anything else?
Thank you, Meryl. I would only add briefly that understanding this issue around hand washing and surface cleaning, that's evidence-based. It's based on what happened in 2009, 2010 that reduced viral load. So that's the evidence, and it helps us, it directs us. But remember those high-risk folks. Those are the ones that we're thinking about in particular. People who are seniors with chronic illness that may have reduced lung function or may have immune suppression because of cancer treatment. They're most at risk, and they should really think about public settings and think about whether they really need to be there.
Okay, and the last question that I have, and I'll turn it over to my colleagues, is, tracking and tracing. I know that is becoming critical as we move to the mitigation phase. How are we working to do a force multiplier to make sure that we have enough people that are tracking and doing tracing? And are we tapping into some of the millions of dollars that I think is being made available from the federal level? I think it's $8.3 million in order to beef up the trackers and the tracing component that we need in order to make sure that we handle that from an epidemiology standpoint.
So, thank you, Mr. Chairman. So, yeah, as you noted, the feds have released $8.3 billion that are involved with dealing with personal protective equipment, vaccine development, a range of issues around developing treatments and the like. Because it's important to note, first of all, that there is not a vaccine. There have been a lot of scams out there saying, click on this link to get your vaccine. Click on this link to get your treatment. There is not currently a treatment, and the vaccine is not currently available. So it's important that people understand that. So what we
online testing.
Yeah, or online testing. That link is, the scams are all over the place. So for us, what we do is we've been thinking about staffing ways to, the state is actually hoping to find a way to expedite those funds when they make it down from the feds to the states, to expedite those to locals so that we don't have to do an extensive application process, because they know we need the money on the ground. During H1N1, we had to bring on additional contract nursing groups and work to support communities that were doing vaccination campaigns. So we're hoping that those dollars continue to be made available quickly for us to act upon.
Great, very good. Councilman, anything else?
That's it.
So Chairman Griffin asked a good question, so I'm going to pose it to both health directors and then open it up to questions to our colleagues. People who are in close proximity in quarters, our homeless community, our homeless shelters, and the county prison, the county jail. Can you speak to that?
Sure. Mr. Chairman, again, with the county and the city together, we have been providing guidance to the Office of Homeless Services. I believe there's a meeting that took place while this was going on, and we're continuing to assist them, Lutheran Metropolitan Ministry, think through how to manage through this. I mean, this is infection disease control. We do this often, and in facilities such as that, this is of utmost concern. We've also been talking very closely with the jails. We're looking at what state and federal guidance is moving forward for us. We're talking to the courts, because a lot of courtrooms, right, there are a lot of people gathering in very close quarters, sort of thinking through each one of those things and providing the kind of guidance necessary for this. We don't have definitives right here to present of how and what those policies are and what they're doing moving forward, but certainly it's a lot of things and people at that table to figure out how to manage those really vulnerable populations and people who need just as much attention as anybody else.
Thank you for sharing that. All right, to my colleagues, I'm watching our colleagues across the table, and their phones are blowing up. So we're going to ask our colleagues, ask any clarifying questions. We're going to limit, and I'd want brief responses from those questions that are being posed to, 5 minutes for each individual, so they can get back to dealing with this pandemic. Council President Kelly.
Thank you, Mr. Chair. First of all, thank you to the public health and public safety communities for your response to this. If this is going to be a longer answer, I will take it offline. I will follow up. In the press conference yesterday and in reading the literature, there's talk of flattening the curve. And what I want to know is that if you look at the curve, is the intent to not overwhelm our systems, our public health and our public safety systems, and should we be expecting a similar number of cases but on a different timeline? Or is this something where we take the actions that are being suggested by the public health community, we'll actually have a lower number of cases?
Dr. Collins, let's take a stab at that one.
Thank you, Mr. Chairman, Mr. President, and I'll let my public health colleagues correct me after I'm done talking. The goal of flattening the curve is really twofold. One is to preserve resources
right,
for a longer period of time, so that when people are critically ill, that the resources, the ICU beds, the ventilators are available for them, as opposed to everybody getting critically ill
all at once.
There is a secondary gain to this as well, though. There is expected to be less transmission, less disease. So I'll stop there and then say, how do you want to correct me?
Is that accurate, Commissioner?
Yes. Yes, that's accurate, Mr. Council President. The idea then is that these mitigation strategies are meant to blunt the curve, the
So
social
the
distancing.
healthcare system is not just overwhelmed.
Right, it's a combination of all those things to
Right.
try to mitigate the full-blown, huge, as you say from the curve, this full-blown unmitigated pandemic is meant to, what the mitigation strategies are what will blunt that curve and break chains of transmission as much as possible.
Right. So, and then just when I look at the CDC, the popularly available curve that's shown, it just seems that the area, there might be a similar number of cases, but what Dr. Collins is saying is that in addition to not having the spike and overwhelming our resources, the result will also end up in a net less cases. And the only reason I ask is that, our job will be to educate the public based on your guidance. And I just want to know, is that a correct reading of this curve, that it's both to not overwhelm resources, but also to decrease the net number of cases that the public should anticipate?
That is, Mr. Chairman, Mr. President, that is our expectation.
Okay.
But, keep in mind, this is also the first time we're applying
Right.
a model like this to a pandemic.
Great. Thank you, Mr. Chair. Thank you.
Excellent question. Majority Leader Cleveland.
Thank you, Mr. Chairman, and thank you to yourself and Chairman Griffin for putting this session together. It's very, very helpful. And thank you to all the team. You're doing a phenomenal job. I know it's important to have great leadership and people who know and care and are just doing what they need to do. So I really appreciate that, and I wouldn't want to be directly in your shoes right now. But just a couple of things.
It's all good.
No,
We're up for the
you
challenge.
all
Go
have
ahead.
it. I commend you, absolutely. Just a couple of short things out of the millions of questions that I could ask. One is just a medical question, and I don't think I've heard this in all of the numerous TV shows and publications. For a person, and I don't know if we even know this at this point, but for a person who contracts COVID-19, goes through and recovers, is that person immune from contracting it again or passing it on to someone else?
Dr. Collins?
I think the appropriate answer right now is we don't have enough data to conclusively say that. I think there's some hopefulness in the medical community, but we'd really like to have the data to support that.
Okay, thank you. And through the chair, I just have a request for you all to help educate our residents, because we're going to field a lot of those calls and questions as we are now in our offices, but also when we're out in the community, people want to know what's going on, what's happening, what should I do, what shouldn't I do, and so I'm looking for some more graphics and information, that we can hand out. Everybody in our city doesn't have internet or cable. We have a lot of people who don't, and so it would be helpful for us to be able to go door to door with information or to mail out information to residents on, these are the things you should do, these are the things you shouldn't do, and in particular with respect to the shouldn't, Chief Williams, when you mentioned the inducing panic, we know we have a lot of people in our community that play too much and go too far, and also people who are looking to avoid other things, who will, call in bomb threats and so that they don't have to go to work or to try to get out of some other things. So, we really need a way to make sure that people understand that this is serious, it's deadly, and, that we're not going to tolerate that, in our community when we're trying to keep people alive.
Councilwoman, through the chairs, thank you for that suggestion. The folks at the Joint Information Center are listening, so they will take heed of your recommendation and put some things together, and we'll make sure that gets to City Council. There's a lot of things developed, and we'll maybe even package with you of if there's specific kind of additional information you would like us to include, but they'll put some of that together.
Okay, thank you, Director. My final request, and that would be to us as a body, is to put together some type of template or guidance for our executive assistants to use when they answer questions, so that when people call, city council, they should get a standard uniform answer and not, different or varying answers or conflicting answers from, depending on which office you call. Thank you.
Absolutely, Majority Leader. Chairman Griffin and I are going to work with our comms team to make sure that we have a clear message on this and provide that for all our EAs. Dean of Council, Mike Polensek.
Thank you, Mr. Chairman, my honorable colleagues, and I want to thank everyone who's here at the table. I specifically want to get into some questions here. Dr. Fauci mentioned, as I've seen him on several times on news broadcasts, that this is 10 times as deadlier than the flu. Is that correct?
I think we all can comment on that, but.
Yeah, so the current data on seasonal influenza, Councilman, is that 0.1% of cases may be fatal. So there is a sort of a moving target understanding what the fatality rate is with COVID-19. There are data in areas of high concentration in China, and we're looking at that data. We're understanding what proportion of cases may not have symptoms and understanding what that denominator number is. And so I've heard anything from 0.7 to 1.4 in that 1% range.
Okay.
So that's where that's coming from, and that's kind of a moving target.
Okay. So more deadly, and at this point, no specific treatment. So I want to ask again, based on your PowerPoint presentation, you've indicated wash your hands, take common sense approaches, but you indicated as well in your presentation that hand sanitizers and wipes do not kill the virus.
Mr. Chairman, to the councilman, some hand sanitizers are considered antibacterial. This is a virus, so an antibacterial wipe or sanitizing product is not going to kill a virus. The pervasive guidance is washing with soap and water for 20 seconds. It does. Sometimes it feels that long. It's true. And if your hands do not, sorry, I'm a little tired. If there isn't any sort of dirt on your hand, you can use a Purell product. There are some guidance of how much alcohol needs to be in.
More
not
than
vodka,
60%.
not the kind of, the scams of creating your own, but the ones that have a high content of the alcohol content to help.
But I think then I would ask as well that there be some clarification, as people are going out in mass and buying hand sanitizers and wipes. They might not be the correct things that they should be buying. So I would hope that there would be some clarification as to exactly what you should be using to sanitize whatever.
60% alcohol content or greater, and we're going to put that in our message to all our EAs.
So the other thing is I want to say specific to the administration. I was listening again this morning where some individual went into a CVS store and purchased every hand sanitizer, everything they could, loaded up 2 grocery carts, one person. I would hope that somehow, again, with this new directive through the mayor's office, that it would be made very clear that stores within the city of Cleveland, anyone attempting to come in and confiscate, and that's basically what it is, confiscate a mass of, whether, I don't care what the product is, that should not be allowed to take place. And I would hope that the group that has been activated on this would be taking a look to make it send out a directive to stores, retail outlets, that if someone's coming in and we know what they're doing, they're taking it to aftermarket, sell it, we all know what they're doing, that should be prohibited. So I would hope, again, somehow that the committee and the group would take a look at that. The other point I wanted to get to, and I've been trying to read everything I can and watch everything I can. We still have some relatives in Campo Pass, Italy. My cousin's been in trying to make contact over it, but that's the central part. But one of the things I noticed in Italy is that they're out of ventilators. And so what I'm trying to find out in northern Italy, that, and now they're actually deciding, according to late last night, who's going to live and who's going to die, okay, in northern Italy. How many ventilators do we have within in the city of Cleveland? Do we know how many ventilators we have here? Do anyone who can answer that?
Not to Mr. Chairman, to the councilman, this may be modified by my public health colleagues, but the state of Ohio does track and survey the hospitals. The hospitals are required to report on a very frequent basis things like the number of regular medical beds.
So can I hold you, Dr. Collins? Dr. Collins, Councilman Palencic, hold on a second. I neglected to say at the onset of this hearing that Director Terry Allen and Director Gordon have to be at a meeting at noon. Well, so you're at 5 minutes already.
Okay, then I'm going to just say, I'd like to know, I'll make the request, how many ventilators and how many beds do we have in the city of Cleveland? Ventilators and beds, because what's clear to me is that this is almost like a military operation. You have to be prepared for the worst and hope for the best.
Yes.
And what's clear to me after all this, and after reading that statement last week, and I read it again last night that came out of China, where they threatened to withhold pharmaceuticals. They actually threatened to withhold pharmaceuticals from this country, like almost giving us a death sentence because of the amount of pharmaceuticals that come out of there. Should be a wake-up call for all of us that we have, as a country, we have to be better prepared.
Yes. Thank you,
Much
Councilman.
better prepared.
Thank you, Councilman. Councilman McCormick.
Thank you, Mr. Chair. And just quickly to echo the thanks to all those who are working on this, and because I have 5 limited minutes, I'm going to jump right into it. We've heard here today through the chair that the virus is more contagious. I'm sorry, yes, the mortality rate is worse. Is the virus, and I'm just going to address this to whoever wants to answer it, more contagious than the common flu? Is it easier to catch if it were apples to apples?
Commissioner Allen? Just keep that thing on.
Thank you, Mr. Chairman. So, thank you, Councilman McCormick. There's something called an R0, an epidemiologic principle. Basically, is what's the infectivity rate or reproducibility of an illness. So, for instance, measles. The R0 of measles is, for every case of measles, up to 12 to 15 people could get measles. It's very infective. You could go in a room when you're fulminating measles, with fulminant measles, and walk out, and someone could come in a time later and be exposed and contract measles. The R0 for flu is 1 to 2 people. So for every person that gets flu, 1 to 2 people could get it. And for COVID-19, the current data is showing 2 to 3. 2 to 3 people could potentially contract it for every case.
Okay. I'm just taking notes here, too. Okay. Thank you. Another conversation that I've heard but have not received clarity, and given the group we have in front of us, I'd like to just throw it out there as well. Is the virus expected to, will there be an impact on the transmission of the virus in warmer weather, more humid weather?
I think the answer is we really don't know at this point because it's never been in a human host, and so we have to wait and see.
Thank you. What advice would the group give on, I got a call today about should my block club still meet? So what advice should we give to our residents on that question? And for those who aren't familiar, I don't know, 10 to 40 residents who get together at someone's house or whatever. Yeah, you know what a block club is.
Yes,
As
I
a former
do.
council
I
person.
do. Mr. Chairman, to the councilman, I think that it's a lot of just trying to think rationally about social distancing, right? So if somebody is sick, we are asking people to stay home. If you're exhibiting any kind of flu or cold-like symptoms, stay home. If you're well, it's a matter of, just as the councilman said at the onset, is greetings might be different. You might not be shaking hands or fist bumping or any of this, and just kind of thinking about close proximity of people, or perhaps having it outside on a porch. The weather's been so balmy, that's an option in mid-March. Pardon? Gymnasiums, places where people can spread out a little bit more. But just kind of thinking common sense of how to make sure that you're not sitting as close as Chief Williams and I are sitting, but ways that we can kind of think through for the public, and
Thank
also
you.
just kind of managing public.
Thank you. And through the chair, for at-risk groups, I'm just going to list what I've heard, and then please add if there are any seniors, those with pre-existing conditions, especially respiratory or pulmonary conditions. Are there other groups that we should be aware of or flagging?
Yes, Mr. Chairman, Mr. Councilman, patients with diabetes, obesity, hypertension, and these at-risk groups are listed on the CDC site, and I encourage people to go back to the CDC and ODH websites for information, because it changes as we learn more.
Thank you. And Chairman, I'll just end with, it's either a question or a comment if anyone wants to answer it, but one of the, again, calls I've received in commentary is if things like schools shut down, obviously health and spread is number one, but a quick number two are the amount of kids in our city that get breakfast and lunch from school. So I don't know if that the administration has thought about that, but you know, how do we make sure that, of course, public health number one, but again, shortly after that, our kids that rely on schools are getting taken care of?
Mr. Chairman, that is why the mayor created this committee. As I said, I've been talking to the food bank, and we've been talking to the schools very, very frequently. There are implications for every single action taken. You know, I'm not saying we're doing this, but should the city decide to close a facility, what happens with people who rely on that facility? It's the same with childcare, right? It's the same with people are congregating to get food. So each and every one of those things are being thought through, and every implication for a decision made, specifically for our most vulnerable people in the community who need food, who need some of these basic human needs, and we need to make sure that we're meeting them and addressing them.
Chair, on that
Thank you.
point, can I get a point?
Wait, let him wrap up his point, then
Okay.
I'll come to you, because I'm going to excuse these two at 11:45. The others will stay.
Just
Please.
really quickly at the table, I've heard the food bank. If residents want to give money or support, are there any other suggestions from the table beyond the food bank?
Mr. Chairman, we will try to advise as some other opportunities. I know philanthropy has reached out to us as well as how they can help. We're just kind of all thinking through this. This is moving very quickly, and as we've been sitting here for 3 hours, right, or 2 hours, right,
Almost 3 hours.
Our phones are blowing up of like how and what and all of this. So it's also very helpful for you to think about this and see what are the needs in the community so that we can help meet them, and not just us kind of constantly like throwing out ideas. So, you know, working in partnership, any ideas are welcome.
Thank you, Councilman Kevin Conwell.
Thank you very, very much. You know, Mr. Chair, you mentioned about the homeless, and I wrote down some things about that, and through you to the City of Cleveland Director of Health. When you were narrating, you went by real fast, and let me ask this question before I get to the other question, is that the committee that the mayor set up, who sits on that committee, and who are the experts on there, and they're from where? Director?
Mr. Chairman, to the councilman, this is the mayor's senior executive staff. We are accessing experts in the community as needed. The reason the mayor had the hospitals by his side at the press conference yesterday is because we are relying on our experts to help us and to guide us through with decision making as we go. So we might not have everybody's know everything at that table. It's impossible. So we have a community with a wealth of information, along with, again, constantly looking at and requesting and utilizing and employing guidance as it's provided.
You know, and okay, that was great. Switching gears, going back to Chairman Zone, the Cleveland Homeless Services, is there systems in place to increase sanitation and education awareness to get into the belly of where the homeless are at, to give them services and resources so that they're not left out. You went very, very fast over it, and I know you really care, but I need to understand. Thank
Director?
you.
Mr. Chairman, to the councilman, I mentioned that there was a meeting this morning, and there continues to be ongoing consultation and thinking and meeting with the Office of Homeless Services, Lutheran Metropolitan Ministry, and others about, and again, the courts, the jails, et cetera, on how to assist with ramping up sanitation measures, social distancing, if that's at all possible. I mean, this is across the country and the globe. People are trying to figure out what is the best guidance, what are the best precautions to be made. But we are working lockstep with all of these organizations in the community, especially those who serve the most vulnerable.
So, Director, because I need to move forward, are we, the city, going to put sanitation, hygiene supplies, and gathering places throughout the city of Cleveland? Director?
Mr. Chairman, to the councilman, Director Cox and I have been talking very, very frequently. We have new signage and additional signage. His team and Carmen, they you hopefully have seen them much more around City Hall, and they have really ramped up all of the sanitation measures in all of the city facilities and wiping down commonly touched surfaces multiple times a day. Making sure there's soap in all of the dispensers as we're encouraging people to wash their hands, making sure there's enough paper towels, because you do need to use the paper towels to open up the doors after you wash your hands to keep your hands clean. But this is, and Chief Darnell Brown through operations have been working really closely as well with Director Cox on all of those types of needs, as our facilities are used quite often and visited by a lot of Cleveland residents.
So let me do two more, then you can respond. Just real quick.
Final question.
I'm almost finished. I took your press conference, and I gave it to my resident, not my residents, to my outreach team, and we have ordered 3,500 of the mayor's press conference with the county. And we will hit the streets this weekend, dropping the flyers off to my residents because they need to know. That's
Great.
First thing first.
Okay.
So we'll push that. And so what do you need council to do also, other than that? Because we're hitting this weekend.
That's great, Mr. or Councilman, through the chairs. The more we can get out the right information, the facts, having people access resources, and those facts is so critical. Making judgment calls, as Councilman McCormick mentioned, of social gatherings and employing ways to stay away from people if they're sick. The JIC is, I've gotten a couple texts from them. They're trying to put some things together that can help you and help make sure that the right information is put out there. It's also, again, trying to help us all mitigate panic. There's a lot of people working on this. Everybody's working on it. Everybody has a part to play.
Thank you, Director. Councilman Charles Life.
Thank you, and I know we're racing the clock. There's been some chatter in the media about the availability of test kits. Do we have any direct number of the number of test kits in Cleveland or Cuyahoga County, or are we able to speculate on how they will become available and whether or not that's sufficient?
Thank you, Councilman. So here's what we know is that the state has been recently receiving additional test kits from the federal government. So the state is working on it. We have a testing protocol where those that have the most serious illness that are among those at risk, those tests go to the state health department, and we've been working together, Director Gordon and I, on how those can be transported quickly for turnaround times within 24 hours currently. There is another stream that has been, as Director Gordon mentioned earlier, we now have private companies too, LabCorp and Quest, and local hospital systems are using those private companies to run tests for those that are less in terms of illness, severe illness, and also meet CDC requirements for testing. And that turnaround time is somewhere in the 3 to 5 day range.
Okay.
So they're still ramping up.
Thank you. During your presentation, you noted that it appears that the virus is most contagious when people are at their peak symptoms. Are people contagious when they're asymptomatic, when they're not disciplined? It's in that dormancy period, the 2 to 14 days?
Mr. Chairman, a lot of this is evolving. We don't yet know enough, I think, to be able to answer that emphatically.
Thank you. And finally, to the administration and to my council colleagues, as this unfolds further and we figure out our strategies to communicate this with our residents, I think it's critical that the Department of Aging is keyed into all of this. I've heard some, honestly, flip comments from some people about if you're younger, it's much less of a risk. But that 1% grows a deal as people become older. We've mentioned that senior citizens are a vulnerable population, and to the degree that we can help them, minimize their exposure risk, I think that's something we really need to focus on further.
We thank you for that, and we're working very, very, very closely with the Department of Aging and been doing that for the last month and a half. Thank you.
Councilman Bashir Jones?
Thank you, Chair. Chair to the Director, it's imperative, in my community, we have a lot of senior buildings. How are you contacting, how are we getting the message to CMHA, private ownership as well, so that we're making sure that they're getting the information out quickly?
Mr. Chairman, to the councilman, we've been working through the Department of Aging, who has contacts in all of the senior buildings and all the senior centers, in the city, and we've been providing them information. Director McNamara has been instrumental in making sure that that information is provided regularly. But the more we can do, the better, and we'll, as we've been saying here a few times, we've got the folks over at the JIC busy at work creating some additional collateral that can be helpful.
Okay.
One of the things, Councilman, from the county side, we've also been working with Jeff at CMHA, the CEO. I was in contact with him personally yesterday and this morning about making sure him and his public information officers are included in the distribution as well as the guidance for their social service.
Okay. Thank you so much for that. Chair, the most important thing, as the Director has said, is that we're all communicating the same message. And when we're not doing that, so I didn't know the Director of Health was doing that. So it's important that we're involved. So I love what Councilman Conwell said about knocking on those doors. Whatever flyer or something that you guys have that we can get printed out, that we can walk the streets and hand, that's going to be very beneficial. Chair to the Director, in regards to daycare centers as well, I don't know if how is the county communicating with daycare centers, getting information out?
Mr. Chairman, to the councilman, child care centers, every type of organization that we have been reaching out to everyone. We started very early with the senior buildings, senior centers, and with child care and with schools and universities, as those were the primary places where we were originally spreading this information, and making sure that they were taking additional precautions in terms of cleaning and sanitation.
So, Chair, if it's possible, when they're reaching out to buildings in our area, reaching out to daycare centers in our area, it'd be good that they connect with us so that we can go and be boots on the ground, knocking on doors. It's just, once again, that we're all on the same page. Thank you.
Thank you, Councilman. Councilwoman Jasmine Santana.
Thank you, Mr. Chair, and I'll be brief. A lot of my colleagues are so brilliant. I've already asked the questions, so thank you. And I know it's been a long hearing, but I appreciate everyone gathering for such a very serious discussion. So once again, my colleagues have asked questions, but just for clarification, and this is probably for the Director, rec centers. I'm just very worried about our youth and especially impoverished neighborhoods. We know families don't have the means to buy the Lysol and the sanitizers, so I'm just kind of worried about that, and if it's a place that we need to start really thinking about shutting down.
Director, the question was rec centers, and particularly in impoverished area. You talked a little bit about how Director Cox is working to sanitize those, but supplying Lysols, the deficiencies of very particular low-income communities. Any thoughts on that?
The increased sanitation at the recreation center?
Councilwoman Santana.
Do you feel, if they have stated on the table that the coronavirus might be probably more threatening or, probably about the same than Spanish influenza. And I remember at that time, there was a lot of public spaces, public buildings that were shut down. And just with that information, I'm just curious to know if we believe that these rec centers should be closed down, especially in impoverished communities.
Thank you, Mr. Chairman. To the councilwoman, I really appreciate the opportunity to be very clear on this. So the city, every decision has ripple effects and implications. The mayor has called this committee to make these kinds of recommendations, and it is our charge to think through the decision of closing anything. We know what we provide at these centers and how critical they are in our community. And so making those decisions are going through a very serious, thoughtful, rational process. Canceling an event and a parade, while again, not the thing anybody wants to be known for, we appreciate that all of those organizers recognize the public health message and heeding it by doing so. We're taking every precautionary measure for any public space that the city of Cleveland has authority over, and we know that the county is doing the same, as our municipalities across this country. But it is, these resources play a very valuable role in our community, and closing would require an enormous amount of thought and foresight of what it would take to do that and how to make sure that people are still served in this community.
Okay. Thank you. I appreciate your answer. And then just lastly, I mean, if we know that English speakers are confused about all the information that is out there, I am sure my Latino community is as well, and even more so.
So most things, I'm sorry to cut you off. We are trying to have as many documents translated and updated because the documentation gets updated. So I think we have about 7 or 9 languages that we've been translating most of our documents on at the clevelandhealth.org, and printing those as much as we can.
And also, Director, I would add that if in the ability, when we have the opportunity to have televised stuff, if it can be signed, a lot of people are hearing
Right, so
impaired.
there's a high demand for all of those very talented, smart people who translate and who sign, so that is, we're working through that. We appreciate that.
I want to thank everyone who came on behalf of our colleagues, Cleveland City Council. We so appreciate this here. And again, the food bank needs help. Please call the food bank.
And we figure out our strategies to communicate this.
GreaterClevelandFoodBank.org to sign up to volunteer. We so appreciate all of you being here on this committee. On behalf of Chairman Griffin and myself, this committee meeting stands adjourned.